Good afternoon. A very warm welcome to our speakers and delegates from all over the UK, from Australia, Austria, Brazil, Canada, Ireland, Italy, Malaysia, Nigeria, Paris, Switzerland, and the United States of America. Today's inaugural Global Arts for Brain Health Changemakers conversation marks the start of World Alzheimer's Month. Our Zoom conversation series is inspired by the phenomenal legacy of Baroness Greengross, who died last year. As co-chair of the all-party parliamentary group and patron of Arts for Dementia, Sally did so much over the years to advance Arts for Brain Health strategy in Parliament. It is an honour to be running this programme in association with the Greengross Age Irrelevance campaign, and in collaboration with leading educators today, to share international practice to inspire new arts for brain health opportunities around the world. In view of fears and stigma people feel at the thought of their deteriorating brain, both privately and in public, we refer to Arts for Brain Health as constructive action on the part of both facilitators and their sensitive participants who may be in denial of dementia. Melvyn Bragg, the broadcaster, author and parliamentarian, talks with learned passion of the role of culture in society. Arts are significant in our lives, whether singing to ease birth contractions, to please and calm our children on the school run, they're singing, dancing and painting in or out of school, etc., youth music, choirs, and community arts hubs, arts keeping us fit, masterpieces and performances, opening our minds to new discoveries. Taking part and creating strengthens our cultural identity, relieves stress, strain, and preserves our brain health lifelong. How crucial this is for people experiencing early symptoms of a dementia. Each year, there are 10 million new cases worldwide, over 200,000 in the UK. Diagnosis can take years. For individuals and their partners, carers if you like, fear of their deteriorating brain brings immense strain and fear. The very fear, even shame, that keeps them from facing others outside their house. Arts involvement bridges the peri-diagnostic support gap for them and their loved ones and provides a lifeline ongoing. Regular arts activities addresses modifiable risk factors for dementia and protects against the advance of cognitive decline. For example, learning music, poetry, or drama, exploring works of art, finding the artist or composer's intention challenges the brain to create new neural pathways. Social weekly activity, music, dance, creating theatrical scenarios, connecting actively with nature and politics, protects against loneliness, physical inactivity, obesity, and depression. Choosing to participate empowers people to preserve interests, companionship, and well-being together in the community for longer. It is not our ailments or medical state that define us. It is our pursuits that define us and raise our spirits. The means to connect with local opportunities has been revolutionized by the introduction of NHS social prescribing link workers, to whom GPs can now refer patients from the very onset of dementia symptoms, to direct them to local arts and well-being groups of personal interest. Over the next 15 months, professors of innovative aging and arts for health will introduce conversations between people young and old who will share their own experiences of using the arts to override symptoms of various dementias. They are reviving and developing new skills, and their best-selling books are inspirational. Each conversation will bring wider attention to a specific theme. For example, we shall hear from artists with young onset dementia in October, followed by those with rare dementias in January. Today, Christopher Bailey, who leads Arts and Health at the World Health Organization, will give an insight into remarkable examples of best practice. Then, in order to make social change a reality, our focus will be on multidisciplinary education with Professor Brian Lawler of the Global Brain Health Institute Dr. Thomas Cador, who leads University College London's Master in Arts and Sciences in Creative Health, Kunle Adewale of Nigeria, founder of the Global Arts in Medicine Fellowships, and Dr. Bogdan Trivajurka, founder of the Global Social Prescribing Student Champions Scheme. We are enormously grateful to our speakers today, whose guidance inspires best practice in arts for brain health the world over. And to introduce the Greengross Age Irrelevance campaign, I have great pleasure in welcoming Kay Allen. Kay, who is Age Irrelevance's campaign director, formerly served on the Disability Rights, the Equality and Human Rights Commissions. Perfect. Age Irrelevance is all about inclusivity. Kay, do tell us about your mission.
Thank you so much, Veronica. I'm thrilled that we've got a lecture in the name of Sally up and running. I am certainly not an expert in your amazing fields with the speakers that are on the call, but just to give you some context, Sally was an incredible person. Some of you may have known her, but she was one of the world's leading advocates on age as a massive subject. And in the United Kingdom, she was made an honorary fellow of the Royal Society of Medicine. And I know that she was passionate about inclusivity once people had their dementia diagnosis. I knew Sally 30 years ago, and I had the great privilege of working with Sally alongside her on many boards and serving as commissioners with Sally. She was always ahead of her time. And 30 years ago, she talked to me about why there was discrimination if we remove the age barriers. 2 years ago, just before Sally was diagnosed with cancer, she came to me and said she had this last big idea. Her last big idea was around age irrelevance for society. And she wanted age not to define us and to put us in those silos. And she wasn't talking about older people. She was talking about every age and how every age can benefit from those intergenerational connections and how we can look at the stages of our lives as we move through it. She had a great analogy and a great story. She said, imagine you were in a play and you were 2 weeks from going on stage, and the producer and director came to your cast and said, you have to stay on the stage for an extra 40 minutes. Do you just lengthen the final act? Do you add in a few more scenes, or do you rewrite the play? Where Sally was at is that she wanted us all to rewrite the play, because imagine if we're all now moving into that era of longevity. We're living to the 100-year life. The 100-year life is going to become our normal. And the 4-generational family, it's becoming the normal, certainly in the UK and in other countries. How do we change as society? And Sally was a great parliamentarian, and she believed passionately in policy and governmental changes as well. But if we are going to live for 100 years and have 4-generational families, she knew that would have massive impacts on society. It would impact on how we save for our pension. It certainly will impact on age-appropriate housing. And of course, it has massive impacts as we all age and live for longer. She wanted us to age better. She wanted us to think about the 100-year life as that amazing gift, the gift of extra time. And so there she wanted me to launch a series of challenges to us as individuals. What will we do with our gift of extra time? How does society benefit from our gift of extra time? What government's doing, Sally was fiercely against. All they're doing is stretching one of the acts within that play. They're making us work for longer. They're making us stretch our pensions out for longer. But what Sally wanted to do was rewrite how we perceive and look at work, how we have a relationship with our employers, dipping in and out, multiple careers, different pathways. But in order to have different pathways at work, we need a different approach to lifelong education. And we certainly need a different approach to pensions. And the idea of us living longer for better, as we know that dementia is becoming more prevalent, and we are seeing people living longer. They're living longer with dementia. And I know from my own family story that my dad was born in 1920. And he did what government expected him to do. He had a good education, he had a good job, and he had a job for life. He started as an apprentice, he retired, and he died 7 years later with enough money in his pension. So my dad kind of did what the government of the day expected us all to do. My mum, on the other hand, my mum was a fearsome lady and always bucked the trend. And my mum lived till she was 98, and she lived well with dementia for 9 years. I know from my own personal journey with my mum and dementia how art and music really kept her engaged. She could remember every word to every hymn that she'd ever learnt in church, despite the fact she couldn't remember my name. So the campaign, just to close then, is about finding amazing ambassadors, people who are passionate about all areas of society, not just health. Finding those amazing ambassadors who are well connected. The second part of our strategy is to organisations that are going to deliver change, to deliver the mission, to take age out of the equation, to stop us putting people into silos of age and defining us by the number of birthdays that we've had, but rather look at everybody as a generating age and a purposeful age. So I'm delighted that Veronica approached us, and she's brought Brain Arts for Health on board as a change maker. So these lectures and the evidence that you all collate over the next 2 years will form part of our evidence reporting on our change makers. Because the third element of our strategy is to capture the examples and the evidence of age irrelevance. What Sally was really clear about is this campaign is not about research. She created the International Longevity Centre to do that research. This campaign is about action. This campaign is about removing the barriers to society. But more importantly, this campaign is about positivity and optimism. Sally didn't want me to mention the word ageism, discrimination. She didn't want the language of the tsunami of old people heading towards each country as a problem and a drain on the NHS, a problem and a drain on our national health and on our pensions and our tax system. On the contrary, the age irrelevance campaign is to say, how do we define the longevity and the gift of extra time as an amazing gift back to society? And how do we add those benefits back onto the balance sheet of positivity in each of our countries? And that's where I hope that the lectures that Veronica's doing will give us that evidence. Because if you can show how you can help people live well with dementia for a long time, think of the savings that you will make to the NHS. Think of the savings that you would make to the care home system if people could live independently with their families for longer with your amazing support. So the Age Irrelevance campaign, we're going to run hopefully for 2 years. We're going to be featuring in housing conversations, education conversations, work conversations. And I'm delighted to say that age irrelevance will be one of the core debates at this year's Anthropy conference in the United Kingdom at Eden. So we are leading the way to say, how do we deliver brilliant age inclusivity? How do we remove the barriers? And how do we create a new narrative for people around the world to talk about longevity as a positive optimism rather than a problem that has to be solved? So thank you so much, Veronica, for creating these debates. And I look forward to seeing the results and the evidence of the debates as they unfold over the next 2 years. So thank you very much, Veronica.
And thank you very much, Kay. And now there's a challenge. We talk about what we all wanting, our purpose is lifelong education. These programs, the involvement with the arts is to continue learning and discovering. And the great thing is intergenerationality, the young, the old, educating the young, and the young inspiring the old. And so indeed, society will benefit by the aging population through their involvement with the arts. And I look forward very much to hearing now from Chris, because Chris is going to give us really fascinating insights from Chris Bailey is the Arts and Health Lead at the World Health Organization and co-founder of the Jameel Arts and Health Lab. This lab focuses on the evidence base for the health benefits of the arts by building up a global network of research centres to look at effective practice, as well as the foundational science of why the arts may benefit physical, mental, and social well-being. Truly rewriting the play, isn't it? To support underserved communities around the world. Chris, it will be fascinating to hear your healing arts highlights.
Well, I hope so. As you and Kay were talking, I was thinking about my grandfather who died many years ago, but he lived to be 100. And I remember at one point in the last years of his life, he was like a lot of older people, feeling a little lonely because he was outliving not only his friends, but the children of his friends. And in that feeling of isolation, it was exacerbated by the slow eroding of his faculties. He couldn't hear as well. He couldn't see as well. He began to mumble, so he couldn't be heard. And his memory was failing. And one day I was talking with him, and I noticed he was in a particularly good mood. And that hadn't happened in a while. And I asked him, what changed? What made you into such a good mood? And he said, well, you know how I've always loved mystery stories. And he had this amazing collection of mystery stories on his bookshelf. I said, yes. He said, well, I suddenly realized that with my failing memory, I don't remember the endings to any of them. So I'm going to spend the next few years of my life rereading them all and being surprised. And I loved that because it was a way of getting back to that sense of discovery and that sense of opportunity and surprise. So at WHO, we, with the UN, actually declared this decade that we're now in as the decade of healthy aging. And in 2020, there was an interesting milestone for our species. For the first time, the number of people who are 60 years and older outnumbered the number of people who were 5 years and younger. And that was kind of a tipping point in this demographic shift. And as far as WHO goes, one of the things we're interested in is not just treating the conditions of an aging population or simply lengthening the lives of people, but actually looking at the quality of that life within the life course. And it gets back to our fundamental definitions of health and mental health. The WHO definition of mental health is from our 1947 Constitution, is not merely about the absence of disease and infirmity. It's about the attainment of the highest personal level of physical, mental, and social well-being. And in terms of healthy aging, that means at any point in the life course. So if you're an older person, what can be expected to be your highest physical, mental, and social level of well-being? In our definition of mental health, it's in some ways ancillary to the definition of health itself. Like the definition of health, it's not merely about the absence of mental illness or mental conditions or their symptoms. It's about your ability to cope with the everyday stresses of life. It's about being able to achieve your highest individual potential in terms of your skills and faculties at that point in your life course. It's about being productive. It's about participating in community. It's frankly about acknowledging moments of joy. And if you can do all of these things, you are mentally healthy regardless of what diagnosable conditions you may or may not have. And I think that's important to remember because that opens up, for one thing, a different way of measuring health. It's not just about what deficits can be alleviated. It's about what assets can be brought to the table. And that, I think, is the whole movement behind the Healthy Aging campaign is looking at the assets, looking at not merely surviving, but thriving. At which brings us to the use of the arts in this context. People are surprised that WHO has an arts and health program, but actually, we've been involved in the arts from the beginning of our history, but usually in the context of health promotion. But even when you look at a health promotional context, using the arts, other things begin to emerge. I'll give an example. There was a program in Mumbai, in India, of trying to educate women in the Dalit community about access to medical care for women. And the idea was to have the women themselves write a play and be able to show this play to the community to help encourage the knowledge of how to get health information, where to get it, etc. And so in the writing meeting, this group of women were gathered around, and pencils and paper were passed out to each of the individuals. And an interesting thing happened, because before even any word was put to paper, a change began to happen. There was one older woman who lifted up the sheet of paper and said, "What am I supposed to do with this?" And we said, "Well, you're supposed to write down your ideas for the play." And she said, "Why would I ruin a perfectly good piece of paper by writing on it? I'm a fishmonger. Paper should be wrapping fish." And that was her perspective. Another woman was clutching the pencil and tears were streaming down her face. And we asked what was wrong. And she said that this was the first time she had held a pencil since her marriage at 14 to an older man, who then forbade her from ever writing again. And so just the act of writing itself became a change for her, a transition. And it got me to thinking about the nature of communication and the healing nature of communication, regardless of what health content may or may not be communicated. And it brought me to a quote that I've often used in these conversations by Carl Jung, who said, "Loneliness is not the absence of people. Loneliness is the inability to express what matters to you most." And in the latter third of our life course, it's that inability to express that becomes so painful. And that inability can be aggravated by a physical disability, by our failing senses, our hearing, our sight, our ability to speak, or even having someone to speak to, of isolation, of friends disappearing, of a feeling of irrelevance, that the stories that you have to tell are not wanted or felt to be interesting by a younger generation. So how can the arts and creative expression address things like that? Well, I think it can address it on so many different levels. I'll give one concrete example. I've been involved with Renee Fleming in helping organize with the LA Opera LA Arts and Health Week for the last 2 years. And we had one event in Koreatown in LA, where the local community center had shown through a survey that the two population groups that were most affected by the pandemic in terms of feelings of isolation were the elders and the teenagers. And when they brought in professional help for psychosocial support, it was the older generation that rejected it, that they were too proud. They didn't really understand what was being asked of them, what help was being offered. So they took a different tact and they asked them, well, what is important to you? What is a cause of concern or anxiety that we can talk about? And they said that the young people in their community weren't learning the food ways of being Korean. So what they then did was created this kimchi fest, where literally, and I saw it, it was hundreds of people, the elders of the community would bring in the younger people and physically show them how to make kimchi. Their hands would join together in the bowl. The older people would take out the cabbage leaves and fold in the spices. Their hands would touch. And as that knowledge was being transferred, there was a physical connection, but also a connection of stories. And the stories began to flow out of their aunt and Seoul who had this recipe. And pretty soon there was this joy and the sense of community that was emerging. And we saw in the surveys following an added ability to cope with the pandemic, a sense of hope in the future, a stronger sense of community on all sides. It was a measurable change. So I think when we think about the WHO definition of health, of physical, mental, and social well-being, the arts have a lot to say in all aspects. But there's a second quote of Carl Jung that I think is particularly important for the last third of the life course discussion. And that's when he said, meaning is what allows us to endure. And I think for many people who are facing the loss of their faculties, the loss of their friends, increasing isolation, and growing awareness that death is not only inevitable, but may come soon, there is an instinct, a reflex to try and find some kind of authentic personal meaning in that passage. And it's the arts that can allow us to find that and make it true for ourselves and give that portion of our life meaning, not just for ourselves, but for our loved ones and our caregivers as well. There's been a tremendous amount of research done in the beginnings of life and the formation of personality and intellect in the first 5 years, in the teenage years, and how the arts can play a role in that in creative expression, but comparatively less for the end of life. And I think here's where this opportunity comes for measurement as well, to see how using tango in South America can help Parkinson's patients express themselves, maybe not roll back the disease, but to find a way of expressing and of connecting. How programs in museums can bring in dementia patients and through curated conversations find those moments of connection, those moments of memory, those moments of grace, of reconnecting to each other, to the world, and to themselves. And I think when we can participate in such things, it not only gives a better quality of life to older people, regardless of whether they have a debilitating condition or not, but in fact, it ennobles and raises up all of us, because we are all part of one human family. And that in the end, I think, is the blessing of the arts, being able to help us find the authentic meaning. It may not cure our conditions, but it certainly helps us curate our lives. Thank you very much.
Gosh, so much, Chris. Thank you so much. Arts helping people reconnect to themselves, to the world, and to others. I mean, and arts helping us to express ourselves. And dancing, the tango in South Africa for Parkinson's, and also dance for dementia helps people to express themselves. There is so much there from Jung, and I really look forward to transcribing it and talking more in the conversation. Thank you, Chris, very much. To hear it from you is extremely special. And now I'd like to introduce Brian Lawler, Professor Brian Lawler. Brian is Professor of Old Age Psychiatry at Trinity College Dublin and Site Director of the Global Brain Health Institute. He is geriatric psychiatrist, specializing in dementia, later life depression, loneliness, and brain health. His research interests range from early detection and prevention to evaluating new treatments for dementia. Brian's transformation of the narrative of dementia from one of tragedy to hope inspired our entire programme and that of the Global Brain Health Institute's Atlantic Fellows for Equity in Brain Health, who will be the subject of our next year's World Alzheimer's Month conversation. Brian, your Atlantic Fellows come from a mix of disciplines and from all over the world. Could you give us an insight into the GBHI Fellowship Programme? Thanks.
Thanks, Veronica. I'm delighted to be here and talk about Global Brain Health Institute. And I'm completely at one with Chris and with Kay with regard to the need to reframe, rethink how we see issues of aging and dementia, really reimagine and look at them in a different way and in a creative way. And I think the arts are core to how we may be able to do this. So in our approach to dementia, we very much need creative solutions that go beyond the existing professional silos if we were to overcome the great fear and stigma that is preventing us from taking effective action for dementia right now. And for people over the age of 50, dementia is feared much more than cancer and stroke. And there's very much a sense of hopelessness and despair when it comes to talking about dementia, a belief that there's nothing that can be done and that it's going to happen to us anyway as we age. But the reality and the truth is that dementia is not inevitable, that there are many social determinants that can be addressed, that risk factors can be reduced, new medications and treatments are becoming available and can be developed, as we saw in the case of cancer. And that rethinking dementia, reframing dementia from the perspective of brain health allows us to take action to improve the health and well-being and quality of life of people living with dementia right now. But the field of dementia is very siloed across professions and disciplines. There's a lack of awareness about dementia among the lay public and healthcare professionals alike, and stigma is very much rampant. So we need this reframing, these new perspectives and approaches to tackle the issue. And that's where the Global Brain Health Institute and the Atlantic Fellows for Equity and Brain Health program comes in. So GBHI was founded in 2015 from a generous grant from Atlantic Philanthropies to bring this new perspective and approach to address the many inequities across the life course that cause dementia, and to take a transdisciplinary approach to changing public policy and practice so that the lives of people at risk of dementia and those living with dementia and their care partners would be improved. And central to this is changing the dementia narrative from tragedy to hope and reframing dementia from the perspective of brain health, shining a light on the many upstream inequities and social determinants that influence the development of dementia. And taking a brain health approach to dementia emphasizes that there are ways that you can protect your brain, reduce risk to your brain, and that you can improve your brain function, even if you have dementia. And this perspective, I believe, is crucial if we're to address and overcome the negative attitudes that permeate society around dementia, its diagnosis and its treatment. And arts and creativity are very much part of this story, as you heard from Chris. Arts, music, culture are an important part of the framework of hope for dementia. And this has been put beautifully by many people, but particularly by Gerhard Richter, the great German visual artist, who said, art is the highest form of hope. So let me tell you a little bit more about the structure and organization of the Global Brain Health Institute and the Atlantic Fellows for Equity and Brain Health program. So GBHI has two founding sites, one in San Francisco at University of California, San Francisco, and one at Trinity College, Dublin. GBHI's mission is advanced in three main ways. Firstly, through advocacy. Secondly, through knowledge sharing and education. And thirdly, and most importantly, through its fellowship training program called the Atlantic Fellows for Equity and Brain Health. This fellowship has been created to fill a gap, to train interprofessional leaders in the area of brain health and dementia prevention from all around the world, but particularly coming from low and middle income countries. So our fellows train together in both Dublin and San Francisco in a one-year residential program. And a very important and novel aspect of the fellowship is that these fellows come from all branches of medicine. They come also from psychology, from the social sciences, from engineering, from architecture, and of course, from the arts. And I'll tell you more about that later. But diverse perspectives are encouraged so that we can arrive at innovative solutions for brain health and dementia prevention. We've just started with our 8th cohort in Dublin and San Francisco. We've now over 200 fellows spread all over the world in over 40 countries. With regard to the training program, we have 4 pillars to the fellowship learning experience. First of all, we have a taught curriculum. Secondly, fellows are exposed to clinical and lived experiences. Thirdly, there's a faculty mentorship program, and then leadership and skills training. Fellows also have an opportunity to apply for pilot funding to carry out a project in their home country on their return to help with their transformation in their local region or community. The program and training is very much values-based and strongly emphasizes the incorporation of values of authenticity, fairness, openness, respect, courage, and empathy at all times. The taught curriculum during the one-year residential time here is a mix of scientific and clinical topics that includes health economics, policy, ethics, epidemiology, and arts and creativity. And following the one-year residential program in California or in Dublin, fellows join our global Atlantic community as alumni and are supported by GBHI as they begin to transform back in their local community. A key part of what we offer here at GBHI is this strong sense of community, networking, and support that continues throughout the fellows' professional life. So now let me focus on the incorporation of arts and arts methods into the fellowship program, which we've worked on intentionally over the 7 to 8 years that we've been in operation. At GBHI, we embrace arts and creativity for brain health as we firmly believe that we need arts, science, and a co-creative collaboration with people living with dementia to change the tragedy narrative of dementia to one of hope. Arts and creativity are a core part of the fellowship taught curriculum, and a significant proportion of our fellows that train at GBHI come from the arts, humanities, and the creative space. As part of the fellowship, artists and creatives interact and collaborate with scientists and physicians to learn how science can inform their practice and how arts and creativity can help transform the scientists' and the clinicians' approach to improve outcomes for people living with dementia and for their caregivers. And creative pedagogy is used to stimulate innovation, open discussion, and to imagine new solutions and approaches. So some examples of how Atlantic Fellows have used arts and creativity to enhance connection and engagement include one of our fellows, Grania Hope, who has a program of cultural engagement with professional musicians to improve well-being and brain health for people living with dementia in nursing homes. Another example is Aline Haas. She's a professor of dance at Porto Alegre in Brazil who employs various forms of dance, including Amazonian dance, to improve function and well-being in people with early Parkinson's disease. Alex Kornhuber is a photographer from Peru who creates photographic images to chronicle the inequities of aging in his home country and help provide meaning to what it's like to experience aging in those circumstances. Atlantic Fellow and French neurologist Eleanor Bayen's creative cartoons educate young children about brain health, and they've been translated into multiple languages and adopted for use in French schools. Dominic Campbell has created international networks for arts and brain health and produced Creative Brain Week, an amazing platform that showcases the power and impact of the intersection of creativity, brain health, and brain science. And importantly, arts creativity can be used as a powerful tool for inclusion for people living with dementia. And this has been captured beautifully in the words of Kunle Aduwala, who you hear in a moment, an Atlantic Fellow from Nigeria, who said that when I engage with people with dementia, there is a joy that transmits the sense of connectedness through creativity that helps them express themselves. So arts and creativity can build brain health and well-being and help turn the fear and stigma of dementia inside out. But we need to continue to bring arts and science together for brain health and advance the research around both how arts and creativity work in the brain and the evidence base of the effectiveness of arts and creative interventions on well-being and quality of life so that we can better inform policy and practice. And again, this is very much how we're behind Chris's initiatives at the WHO. So this is very much a core part of the mission and vision of GBHI and the Atlantic Fellows for Equity and Brain Health Fellowship Training Program. So if you work in the creative space and have a passion to change the narrative around dementia and improve brain health in your community, region, or country, or if you know of someone like that, we'd love to hear from you at GBHI. So please get in touch with us at www.gbhi.org and consider applying to become an Atlantic Fellow for Equity in Brain Health. So thank you very much. I'll hand you back to Veronica.
Brian, it's always an utter inspiration to hear from you and how brilliantly bringing together creativity and science for better life and fusing them together for change of policy strategy, and you do it par excellence. We owe you a lot for your inspiration, and we look forward to hearing more in the in the discussion. I would like now to introduce Dr. Thomas Cador, who leads the MASc in Creative Health program at University College London. His research and pedagogical interests includes object-based learning, culture, health and well-being, public and community-based approaches to heritage. The Creative Health Mass is creating a new generation of socially engaged scholars and practitioners to meet the needs of a changing health, social care and voluntary third sector, where personalised care, a focus on health inequality and the patient experience are mainstreamed into public health. As this programme is the first of its kind in the world, both in terms of the qualification, Masters in Arts and Sciences, and the academic field of study, creative health, it will be fascinating to hear from you, Thomas.
Thank you so much, Veronica. You've sort of said it all. I think you've done my job for you. But thanks for inviting me, and it's really great to follow Kay and Christopher and Brian, and also I know Kunle is still coming after me, and then we'll hear from Bogdan as well. And a lot of what the three previous speakers have outlined really chimes with what we do on the Masters in Creative Health, albeit obviously that the Masters is not specializing in aging, in older people, in dementia and brain health. It's a broader church standard. But I think it relates really nicely to some of the things that, especially, I mean, what Christopher said is very relevant, but some of the things that Brian has just talked about, obviously with the fellowship, the global fellowship program, and also some of the things that Kay spoke about. And that's in relation to how do we change the perspective that people have, the population more broadly, on aging. Because my take on this is, and it's maybe not a very academic take, is that we very much, and if you look at this room here, this virtual room, I guess most people are at least roughly my age. I'm in my mid-40s or above. And I think all of us pretty much, today's professionals, today's leaders, if you want, in different settings and so on, very much have a 20th perspective on aging, as you have a 20th century perspective on aging, as you have a 20th century perspective on so many things. And I think what we really need is think about the next generation of people and that come with a hopefully very different perspective, rather than instilling that dominant paradigm of kind of job for life and what life means and all of those issues and what a good life means and a long life means. So I think that we need to break out of the 20th century perspective. And what this is part of what we are trying to do, I guess, on the Masters in Creative Health, is think about health and illness and well-being in a new way, in a different way, and in a way that we don't necessarily as the educators have the answers for, in a more open way that's meant to be co-produced between our students and the members of the community out there and organizations that work on that interface of art, culture, and health. But let me go back one step and just tell you a little bit about the Masters. I mean, Veronica has said pretty much has summed up really nicely with that strapline of what the program is about. I suspect I'm preaching to the choir here that all of you will have heard about the term creative health and what it may mean, but I just give you a very brief definition, which is essentially, I think, and that's the definition taken from the old parliamentary group on arts and health in 2017 that came out 6 years ago. That's also already been mentioned by Kay earlier. And so the definition, and it's slightly modified. So it's creating the conditions and opportunities for the arts, creativity, culture, and the modifications and nature to be embedded in the health of the public. And what we mean by that in a nutshell, again, two things that have already been mentioned. And one of them is tackling the endemic health inequities that are out there and that are growing in many ways. And it's interesting, we're talking about life beyond 100 or life up to 100 becoming the norm. At the same time, if you look at the CSO figures in the UK, actually life expectancy post-COVID has gone into reverse. people are again, hopefully this was a bump in the road and it will increase again, but people are now dying younger than they did 5 years ago. And that's a serious issue with health inequities. And so that's one of the things we want to address, is that access to health is as equally distributed as possible, and is sort of on a rights-based level on the master's program. So it's a big ask. And one of the things we really are focusing on in relation to that, something that Christopher has mentioned, asset-based approaches. Thinking about the assets, not in a financial sense, but in a social sense, the resources, opportunities, facilities that are already out there in communities that could be put to work in support of the health of the public. So how do we bring those two together? The inequities, on one hand, addressing those through the assets that are actually already there within the community. So that's what we are working on, really, on the masters. And it's very broad in that sense, that every student comes with their own set of interests. And the structure is, it's usually a 1-year program. It can be taken as a 2-year program for part-time students. And half of that program is a thought component, where we have some core modules to do with sort of the basics of creative health. What is it about? What are the different interventions that are out there? What's the evidence for some of those interventions, whether it's nature-based working, gardening, the arts in different performing arts, as well as visual arts and health, museums and cultural heritage. So different approaches and their health benefits, and also thinking about methods and how do we assess the benefit of these aspects. So that's one aspect. And then also one of the cores is thinking about interdisciplinarity and how we need interdisciplinary approaches, how we need to break out of the silos in order to address the problems of the present and the future. And then so that these core modules make up half of what we do, and the other half is made up by a community-based dissertation. So a project where students work in collaboration with a community partner. And I just want to finish with 2 examples that are related, of current year's dissertation projects that are in a way closely related to the conversation today. And one of them is a cognitive stimulation therapy based research project. And I know it's controversial within the field of dementia research, but it's one approach, and that's what the student is doing. So they're working together with a large UK museum, combining object-based approaches to CST, the cognitive stimulation therapy, with dementia patients, and to assess what benefit the object-based element in a museum setting has in a CST framework. And that project is just about finishing up. It's really exciting. And the second one, something that was mentioned also by Christopher, was about when he spoke about the Korean people in California. And the question that really is most important to them is actually what matters to them most in their life. And we have another student who works with an organization called What Matters Most, who are working on conversations about what matters in relation, thinking about end of life and what matters to people. And our student has taken it completely out of the current box that it's in, largely focusing on older people, and brought it into primary schools and talking with teenagers about what matters to them, and young adults, and also as well as older people. And again, very interesting findings. So these are the kind of projects where we're working with a partner organization and trying to shift the paradigm, trying to ask new questions. And then if students are interested in pursuing that, we also have a PhD program. And currently, for example, I'm co-supervising 2 PhDs on dementia research in a museum setting. So these are some of the things we do in that field of cognitive health and dementia. But as I said, the Masters is a much broader church. But I think I better leave it at that and hand over to Kunle, so we have some time for conversation as well. Thank you.
Thank you very much, Thomas. That's extremely interesting. I must admit, I was very impressed by your students and also by going on one of the projects, the line. Absolutely fascinating about the taking what matters most to school, focusing on older people and taking that into schools. I think that's very age irrelevant subject, very, very interesting, making them aware at an early age, and therefore creating greater understanding. And I would love to talk to you more about the PhD program for dementia research. So much to talk about in the conversation afterwards. Now I would like to turn to Kunle. Kunle, how your arts in medicine fellowships have really grown. Kunle, who, as we've heard, he's a senior Atlantic fellow for equity in brain health. He trained actually at GBHI's San Francisco campus. I meant to say, Brian, fascinating to hear about your French campus, which I hadn't known about before. Kunle founded the Global Arts in Medicine Fellowships originally in Nigeria. He's now based in Manchester, and he's a multimedia artist leveraging the fusion of arts and creative technology for seniors' brain health. He is curator and development lead for the Global South Arts and Health Week, and of particular interest today, founder of the Global Arts in Medicine Fellowships. They involve over 1,000 students and professionals from 50 countries in Africa, Asia, Europe, the Middle East, the Americas, and I think it's entirely voluntary, which is extraordinary. Kunle, welcome. Do tell us about your splendid cross-disciplinary fellowship, how it operates, and how your fellows are collaborating around the world to devise arts programs to help people preserve their brain health. Thank you, Kunle.
Yeah, thank you so much for that wonderful introduction. I just want to give a shout out to Chris, Dr. Brian and also Thomas for the wonderful presentations. My name is Kunle Adewale, and I'm the founder for the Global Art in Medicine Fellowship Program, also a Senior Atlantic Fellows for Equity in Brain Health, as Dr. Brian have said. We run a program called the Global Art in Medicine Fellowship Program, which is founded on the culture of collaboration, because again, we think about, when we think about change begins with collaboration, because alone we can do so little, but together there's so much more we can achieve. And in so doing, we try to introduce, a learning opportunity for professionals and students, in Africa, in Asia, Latin America, Europe, and other parts of the world, to start thinking of how to collaborate and develop intervention that they can use to support the aging population, people with mental health disorders and other health challenges as well. The Global Art in Medicine Fellowship was founded primarily in the year 2017-2018 to the grant support of the U.S. State Department and also the U.S. Embassy in Nigeria, to be able to provide platforms where young people and the older generation can connect and begin to have conversation and begin to collaborate to create change that can inspire positive impact in their communities. From starting that program in Nigeria, we've seen how that program has really scaled and grown to impacting more generations and impacting populations across demographics and across continents as well. Our Global Art in Medicine Fellowship, actually, many of them come from the field of media and communications. Some of them come from the field of art. Some of them are musicians, some of them are journalists, some of them are policymakers, even some of them are government officials. And this is very interesting to see how young people, because again, the fellowship is kind of intergenerational in its design, is also very international in its design, and it is also interdisciplinary in its design. We understand that the solution to the world problem cannot be solved by one single person or one single discipline. It takes a village to bring change to the world. And what is happening now is the Global Art in Medicine Fellowship are actually creating that ecosystem, a network, a village of change makers who are actually creating positive impact by leveraging artistic interventions to support the populations in their communities. We've seen incredible change, in different communities in Nigeria, in Kenya, in Botswana, in South Africa, and in other parts of the world, even here in the United Kingdom, where fellows have started collaborating on projects, cross-culturally and cross-continentally and cross-disciplinary to see how they can be able to bring joy to the aging population. There's so much stigma around dementia. There's so much stigma around Alzheimer's disease. And one of the things our fellows have been doing over the years to continue to use creativity to be able to reduce the stigma associated with brain health disorders, by bringing in the virtual reality creative therapies, by bringing in music, by bringing in all the forms of art. Most importantly, to see even our medical students are recently plugging into creativity, plugging into art and health programming to be able to deliver program while they're in college in college, but also delivering program for patients in their institution, teaching hospitals. And for us, we think this is part of the things we are looking forward to seeing how change is being activated and to see how change is being sustained through collaboration. And fellows, through the program, during the program, usually they get to collaborate leveraging social media like WhatsApp platform. So fellows are usually grouped into, because of the large numbers of people who get to join the fellowship from around the world. So what we do is to create a smaller group of regional groups so that fellows can be able to talk to themselves, to be able to start having conversation around the problems actually within their communities. And that way that's easy communication, access, and then become, easy for engagement, for change, for improvement, and to see what can happen in the long run. And in moving forward in that regard, we've seen how the fellows during the fellowship, because the fellowship runs for a period of about 3 months. It's run twice every year. So we have 6 months calendar in every year where the fellows get to learn, virtually every Sunday, 2 hours actually. And during this course of the fellowship program, the fellows actually have opportunity to be able to present, what we call ideation, to pitch the idea based on what they have actually, discussed, based on what they have actually have conversation on. And interestingly, many of these fellows, some of them have never even met before. And it's interesting to see how the Global Health Medicine Fellowship is bringing communities together, closer together, even though people live very close, but they are very separated based on their discipline, based on their cultural practice and all of that. But the Global Health Medicine Fellowship is bridging this gap such that fellows can have access to resources they need to support the population in their communities. One of our art medicine fellows started using origami. Many of us, when we're very much more younger, we use paper to make kites. We made paper kites, right? But it's interesting to see how one of our fellows starts using, paper folding to support the brain health of the elderly people in Nigeria. His name is Toby Shodimo, and today he founded what is called Origami Society of Nigeria, being inspired by the ecosystem and the network, presence of the Global Art and Medicine fellows. And then now he has created a sub-community where he's training young people, training gerontologists, training geriatricians, training brain health advocates on how to use origami paper folding, as simple as that, to be able to bring joy to the elderly people in Nigeria. Another instance is another fellow who is domiciled here in the United Kingdom, who is using creative therapies, VR therapy, to support the elderly people who are actually dealing with cognitive impairment. Her name is Rebecca. I can't remember the last name. Rebecca is creating, using technology to be able to bring the aging population together here in the United Kingdom by providing a transformative therapeutic experience, giving them opportunity to travel to their a choice of destination in the world, giving them an opportunity to experience paintings such as that of Van Gogh or Michelangelo, giving them the opportunity to be able to dance and move their bodies in a way they've never done for a long time. And this is the essence of the fellowship, such that people can leverage resources from art to technology, from technology to other, other disciplines, to see how do we fuse these different disciplines together such that it can become something that can bring positive change or changes into the lives of the vulnerable population. I myself, as a young artist, and multimedia practitioner as well. Over the years, I've continued to leverage creative technologies to support the brain health, of aging population in Nigeria, in Ireland, and also here in the United Kingdom, also in the United States as well. The Global Health Immersive Fellowship Program usually runs, like I said, during summer and also during winter. And presently we have our fellows, over 500 people actually apply to the fellowship from 28 countries in the world. For the fellowship was founded in 2017. So in the space of almost like 5-6 years now, the fellowship has grown to over 1,000 applicants from over 50 countries in the world. I know one thing about the fellowship: is not funded by any corporation. It's not funded by any philanthropy. It's not funded by anybody. This fellowship grows by itself, grows itself, and keeps growing itself. And it's interesting to see where there's lack of resources, how social capital matters and counts, and how young people start volunteering their skills, their time, their resources to continue to ensure that this fellowship continue to thrive regardless of lack of funding. Major setback of several fellowship would be lack of funding, but the Global Health Immersive Fellowship, through collaboration, through creative ingenuity, volunteerism, social capital, the love for humanity has continued to thrive to support the well-being of the elderly across generations. One of the major challenges we realize in the Global Health Immersive Fellowship is cultural challenges. Some of our fellows actually are from the Middle East. They speak Arabic. Some of them can't really speak English or communicate effectively. And then recent times, we have come up in the fellowship to have the Global Health Immersive Fellowship, MENA, which focuses on Global Health Immersive Fellowship for professionals and students in Middle East, such Middle East and North Africa, such as Tunisia, such as Egypt, such as Qatar. We also thought about using the Global Health Immersive Fellowship program by creating another program that focuses on French-speaking countries, focuses on Latin America for those who speak Portuguese and for those who speak Spanish. Because we know that, I would believe that language should never be a barrier to brain health. And again, so we have to start thinking about how to make learning accessible, how to make learning in a way that people can understand how to deliver interventions that is not even delivered in English. And also, how do we start transcribing communications in a way that is easier for people to understand, to deliver interventions, to bring about positive change in their community. So the Global Health Immersive Fellowship, through creativity and collaboration, is bringing change to the lives of the aging population in Africa, in America, in Europe, in Middle East, and around the world. Thank you so much, everyone.
Wow, Kunle, you're such an inspiration. I think we'll have to translate the transcription, and so we have it available in various different languages, thanks to Google Translate and perhaps one or two other people who can help. Bogdan Chivajurka is development lead at the Global Social Prescribing Alliance and founder of the Global Social Prescribing Alliance Student Champion Scheme. And to mark Social Prescribing Day, he actually will be co-chairing a special Greengross conversation in March between a range of medical and neuroscience champions on the impact involvement with participants at arts workshops for brain health is having for them.
Good morning, good afternoon, and good evening, regardless of where you're tuning in from across the world. My name is Bogdan. I'm a medical doctor by background. I'm the clinical and global lead at the National Academy for Social Prescribing. I'm honored to be here, and I'm sad not to be with you in person, albeit being virtual. It's a true honor, and I'm delighted to be here to pay tribute to a great leader, Baroness Greengross, who's brought us all together to discuss regarding a subject very close to my heart, both as a human being and also as a medical doctor myself. I have 3 points that I'd like to share with you that I hope stir the conversation into the direction of travel, that we are talking about more social prescribing accessibility from a clinical perspective, but also I want to touch upon today the idea of developing champions early on for the subject and the importance of education from an early stage in training and career pathways. And I'm going to end with talking a bit about the global perspective in social prescribing. But without further ado, my first point with regards to social prescribing. What about art and culture that's always been around us for a long, long time? Well, social prescribing for the first time ever puts these interventions on the table for clinicians such as myself to use, not after the diagnosis has been made, but in fact, to support clinicians such as myself to go beyond pills and procedures and use such interventions to prevent conditions from happening, but also to ensure and maintain brain health over a long period of time. It's a cultural shift and a paradigm shift that signifies the idea that for once we are looking at creating health within the community and at home. Sure, the arts have been around for a long, long time, and the concept of social prescribing isn't new. But what's new is that I myself as a clinician, for the first time ever, I'm able to build the trust necessary with individuals who are referred to the social prescribing link worker, who's able to then co-design and co-create a pathway for them to get involved in the local community and their local environments at home. Especially for those individuals who may not seek help in the first place. I'm talking the ones who are lonely or social isolated, the ones who would never seek our support in the first place and who would end up in my clinics and seek support for medical issues. Yes, they may come in with a heart problem or lung problems, and we will give them the necessary medication, but such individuals quite often have problems that go beyond the biomedical sphere. And in such circumstances, interventions such as social prescribing that allows us to refer people to the local community services and have some hand-holding provided by the link worker that provides motivational interviewing and co-designs the treatment plan within is very, very necessary. Now, to my second point with regards to training and education, which I know will be a point that will be discussed in a future conversation as part of this webinar series. As a young physician myself, I believe education is at the core of how we have our future doctors. We need to catch medical students. We need to catch university students and health professionals whilst they're young. We need to support them and educate them while their brain is most malleable and open to change. Because what we've been doing for the past years and the past decade or so is we've been teaching people how to prescribe pills. We've been teaching people to think in algorithmic pathways. But when we encounter social determinants of health, our algorithms fail. When the problem is related to how we eat, how we sleep, how much finances we have, how much money we have, or the place we've been born in, our algorithms, our medical algorithms fail us. And in such situations, having interventions such as social prescribing is crucial into the toolkit of the doctors of tomorrow. And this is why, personally, I've been a big advocate for social prescribing being taught to students, not only medical students, but midwives, nurses, pharmacists, speech and language therapists at universities across England. And I'm proud to say that over the past 8 or so years, we've been able to integrate social prescribing successfully at medical schools and other universities across England through the Social Prescribing Champion Program, which you'll hear more about next time. And my final point is just to shed some light on the practices that happen across the world, because social prescribing is certainly not a new idea. It's something that's packaged in a new idea, but has at the root and at its core good community integrated care that happens not only within England, but happens across the world. I've traveled recently to Japan, where I've had the pleasure of seeing Sheikatsu Shien, which is the equivalent of their link workers, the social prescribing link workers delivering social prescribing in the local community. We've also seen Asha workers in India, which is the equivalent of a health visitor that goes from house to house. We've also seen community connectors across Canada and other countries. Regardless of what those individuals are called, this new role and this new involvement in community-based care, be it through a social social prescribing link worker in England, albeit through the social worker in another country, it allows us to tap into the existing assets that are present in the local community. But what I've seen around the world, and what's certainly the case in England too, is one thing is for certain, and one thing is sure: we need to make sure investment is being given and support is being given to the local and voluntary sector to deliver such activities. We know the research behind health and creative health, and the research between arts and the connection between arts and culture and health is very strong. So therefore, it's time for us to start looking at how we can support the delivery of such activities within the local community, and how we empower communities, not just use communities to provide those services. But certainly for me as a clinician, this is a breath of fresh air. It's a move towards a more preventative model, a model where we create health in the local community before issues start to appear. And it's certainly the case for ensuring and maintaining brain health over the course of our lifetime, not only for the elderly, but starting with the younger generation and promoting intergenerational activities along the way. I do hope to see you all soon, and I do hope this will lead to a further conversation within the webinar, and I look forward to meeting you at our future conversations. And once again, we're grateful to Baroness Greengross for all the work that she's delivered in this field, and she's been a true inspiration and will continue being a true inspiration for young people like myself. Thank you very much.
Thank you very much to Bogdan, who is himself a true inspiration. And thank you, Amisha, for putting on the video. Now we come to the conversation between speakers. And obviously the thread that runs through it all these educational projects, is collaboration between the arts and sciences. And it's extraordinary to think about the origami in Nigeria, bringing together young with the old and then setting up a whole society. It's the legacy of the programs that the training achieves is just simply wonderful for a better world. So let's talk about the challenges that, in fact, Kunle raised with regard to language. So Brian, do you ever come across this? Because I know that some of your fellows from far distant countries, and one of them in particular, I think she mentioned in Peru, the language issue. The glory of art, of course, and creativity and culture and craftsmanship is in a way, that's one way of surmounting language. But I wondered if language has cropped up much in GBHI.
Yeah, well, I would use the word language in a slightly different way. I mean, I'll let Kunle talk about the actual differences in language across countries, but I think there is a difference in language between science, medicine, and arts, and I think that, and this is part of the siloing, and I think that, you know, and I found that as we try to build and integrate arts and arts method into our Atlantic Fellows for Equity and Brain Health program, I realized that there was a sense, to some extent, you know, a lack of equity and partnership, you know, between the artists, clinicians, and the scientists. And I think the artists often felt that the people didn't really understand their methods and how they went about things. And likewise, of course, the scientists, you know, kind of said, well, the artists don't really understand where they're coming from either. So there is a difference in language and approach. But I think that the artist and the creative needs to understand, you know, I guess the science, the scientists, and where the clinicians are coming from, because these are different worlds, and vice versa. And I think that, and I think we found that this takes some time and some work in terms of people appreciating the strengths on either side, so that they can really, really work collaboratively together. And I'm struck by what Bogdan was talking about in terms of social prescribing, but I do think there is a lack of awareness sometimes among clinicians around the benefits of arts and health, arts for brain health and arts for dementia. And I do feel sometimes that those people who are providing those wonderful interventions of the arts and creative point of view are still a little bit distant and siloed from the clinicians. And I really love to hear what Bogdan is trying to do now with these this Champions program. It's trying to get in early with medical students, with healthcare professionals, helping them to understand, the importance of the process, the method, the approach, and the intervention early on, not just for their patients and for the people that they look after, but also for themselves. And I'm really believe that arts creativity is not just a huge benefit for the people, but also for the clinicians. It can help heal the clinicians and decrease burnout and improve the quality of care that they can deliver. And as I say, is good for their own brain health. So there is a communication issue. There's a gap. It's a language, but it's the language of science and the language of art, of arts and creativity. And I think we need to just pull those together and help people understand and appreciate, so that they can communicate and collaborate more from a point of view of this equity and partnership. That's what I really want to see as we go forward. And I think that's taken us about 5 or 6 years to try and build at GBHI. And I think we're getting there, but we're not quite there yet.
It's phenomenal. I must admit, we had hearing about when Bogdan started his champions. I'd always had arts students at our art workshop for dementia, and so we had neuroscience and medical students joining with participants. But I think it's also come across sometimes the arts being used for diagnosis. Is that much happening?
I guess sometimes in psychiatry and people who've experienced trauma, arts and can be used in terms of to help people express. Sometimes people, if they've experienced trauma, a particular part, their left side of the brain is their language areas are inhibited to some extent. So sometimes art and other forms of creativity can help people express and can be useful in that way in terms of getting at a diagnosis.
So at GBHI, when do the scientists and the artists students come together? How do they come together?
They're all together. They train together. Cunliffe can speak to this, but I think we're a little bit further on now than we were when Cunliffe started. But I think we have a better appreciation, and I think there's more equity in terms of that partnership between the artists and the scientist and clinician. But they are working. They are together. They are learning. They're training, they're working together, and we encourage them to collaborate together and develop collaborative projects together. But I think it's not that straightforward because of the perspectives, and as I say, to use the word, the language. It's about understanding that and giving them space to help for them to understand each other's perspective and where they're coming from, because that's the only way that we build true collaboration for brain health and for dementia, is when the artist and the clinician and the scientist are working, in equal partnership together.
Oh, fascinating. Thomas, you too have the interdisciplinary approach, and you were talking about how do you bring the scientists and so you've got the first degree, you've got the people, the postgraduates, so you've got people who've already got a medical degree who come to take the MAST, and artists who come and try and use their art for health. How does it work at UCL?
And I completely concur with Brian's point on the languages, because if you're talking about English and Spanish and French and Italian and Swahili, there's Google Translate, there's translators that can communicate comfortably, and we can translate things, but there isn't Google Translate to translate medical jargon into artist jargon or artist jargon into medical jargon. So I think that's a much greater challenge. The medics from all over the world meet happily at congresses and communicate. Artists from all over the world, to some degree, can communicate. The problem is really between those two silos. And that was, in a way, one of the key inspirations for us setting up the program, is create a space where we can try and break out of those silos and have our graduates hopefully happily navigating these different worlds and be equally comfortable with communicating with a group of clinicians as they are with communicating with a group of creative practitioners, as they are communicating in a local community setting in East London, Bangladesh, or elsewhere. So that was really the key. Obviously, that's a tall order, but it's reflected to some degree in the demographic, and that's helping. That we do have students every year from a medical background. We have intercalating medical students. We have occupational speech and language therapists. People have been working in the NHS for a number of years, in the health services for a number of years. Similarly, we have people who come from a fine arts background, who have been practicing artists, performing artists, actors. And we have people who in between, who've done anthropology degrees or epidemiology degrees. And that's the key of the program, is hopefully that at the end, through this mix and the peer learning, as well as the program that we've put together, that they are then happy to communicate across the board on the benefits of arts and health. And I think one key element that needs to be added maybe to that question of language is also, and it relates to the point that Brian was making, that there is still a lack of understanding among medical practitioners, not everybody, but far, of course, but of the benefits of some of this work on arts, creativity, nature, and health. And I think that also relates to the language of evidence and the type of evidence that's accepted by the medical establishment. And that's almost impossible for us on the creative side to match randomized control trials. There's certain things you can create randomized control trials on, but other things you just can't. And
I very much hope we're going to be working on this together. Yeah,
not valid is a problem, right? And I think so. That's another issue, another elephant in the room that we need to talk about. But I see Kunle has his hand up as well, so I'll pass the floor to Kunle, I think.
Kunle.
Yeah, I think you said it so well, and I was listening to what Dr. Brian was saying, and I think you being able to echo it was very good. The language, between the science and the arts, which kind of like is sometimes very difficult. I remember very well when we started the art and medicine program in Nigeria, we were not given access to work in the hospital because of lack of understanding of what the art can do for health and well-being. But looking at what Thomas said, which I actually noted down about the language of evidence, I think with stories of impact of how the art really help being shared, I think is now encouraging access, for carers and for medical practitioners to start embracing creativity. Because again, someone have said that evidence is the end of argument. You cannot argue against evidence. So show us if it has worked. And again, by telling the stories, like some of the things Dr. Brian said about the change, about the program development, all of these are catalysts, for access, for engagement. One of the things I would say regarding for the Global Art in Medicine Fellowship program that we did was more of like, when some of the medical practitioners are seeing the changes in the lives of the population they work with, and then they started joining the fellowship. So what we now do is using insiders to gain more access to deliver more art interventions. Because again, at first it was difficult to penetrate, but now by inviting the insiders into the program, we have seen the evidence. Now they become the crusaders and the evangelists of art in health programming. Because again, it's easier for a doctor to convince another doctor that art works than for an artist trying to convince a doctor that art works. The language, you get what I'm saying? It's easier, right? So bring in the doctors, bring in the scientists, bring in the researchers. Once they're able to see the evidence, they become the crusaders again, they become the televangelists on the use of art for creativity and well-being. And that is what we've seen in our program, and that is why our program has continued to grow. We've seen medical directors of established government institutions in Nigeria becoming fellows in our program, which has never happened before. Medical doctors, again, there's a power dynamics that comes with engagement. There's a power torso that comes with saying, oh, I'm in the science, you are in the arts. We don't have anything to do together. But I think that when people start seeing positive change and how the union of the art benefits, the union of the art and health everyone and humanity, then I think that language is not understandable and access become easier.
Thank you very much, Brian. It's brilliant. Thank you.
I just to maybe to round up on this. I mean, I agree completely with what Conway is saying, but I think one of the difficulties we face now is actually who's in the room. You know, we are. I think the artists and the scientists, clinicians are in the room, but the actual managers and who are actually, you know, and the commissioners are not necessarily in the room, and they're not in the room today, perhaps, and they need to be in the room. And I think
I'll
that's
let you know.
it speaks to the question that Jonathan Kay asked, you know, but how do we convince people? And I often found that the difficulty, I mean, I think the commissioners have and the managers have is that they're dealing with people downstream, they're drowning, you know, they're very, very ill, and they have to prioritize, you know, care, and they prioritize what's available and also based on evidence. So they don't prioritize arts and culture and for health.
I'm on the way out in the sense that I've had a 6 to 18 month prognosis because of cancer in the brain. I'm looking for someone who will take over my work. There might be somebody there who might be interested. Shall I describe what I do?
Yes, and we can also link it to the when you talked a bit about it before, but yes, please do.
Well, I talked before about how media, and I don't mean just television, I mean new media, can stimulate the brain when applied together. I've since had an intervention by a Southampton scientist, very eminent one person, Roxana Kawai, who says that clinically this is a much better way of halting dementia than any of the pharmaceutical intervention, which will not work because of the nature of the amyloids in the blood vessel to the brain. So we are now on the verge of launching our campaign, just at the point at which I'm going to have to leave it, which is a bore. So I'm looking for someone who might take over. So if there's anybody who's looking for a cause, we haven't got any money yet, but we will get some.
May I come and see you then, and we can talk further? And we also have somebody else from Southampton on the call.
We've got a seminar on the 20th of October. Come to that.
Oh, a seminar. Oh, right, on the 20th of October. We'll put this in the we'll share this, Michael, with everybody here and with various networks, and I'll get the details from you for a little bit more about the program, about your program. Thank you so much, and congratulations for your amazing work. Michael's broadcast and had a most incredible career, and is now doing marvelous things. Thanks for mentioning it.